Hey class, this is Patrick Sewell here to do my presentation on alcohol. In our syllabus, it says your class presentation is to be informative and interesting. You may use note cards, PowerPoint, and any other appropriate presentation tools. I see this video as being an appropriate presentation tool. So it's not really a game show, I just thought that was a cool picture to start off with. So enjoy, and hopefully if you have any questions at the end, I can answer them for you. So. Hey, Morgan Brown, I'm going to ask you some questions, okay?
Okay.
Okay. What is the most widely consumed drug?
Tobacco.
Wrong. What types of alcohol were first discovered by ancient civilizations?
Tequila.
Wrong again. When and where was distillation of alcohol discovered?
Jesus times.
Close. No, not at all. Okay. In what year did prohibitionists ratify the 18th Amendment to the Constitution that outlawed the manufacturing, sale, and transportation of alcohol?
The 20s?
Of what century?
1920s.
Yes. Yeah, well, close. 1919. Good job! Woo! Alright, and the answer to that section was, what is the most widely consumed drug? It is alcohol. What types of alcohol were first discovered by ancient civilizations? It was the ancient Babylonians discovered wine, which is fermented grapes, and beer, which is fermented grains. When and where was distillation of alcohol first discovered? Distillation was discovered in ancient China and refined in the 8th century in Arabia, and this process was kind of complex, but it wasn't really widespread until distilleries were commercially manufactured. Okay, in what year did prohibitionists help ratify the 18th Amendment to the Constitution that outlawed the manufacturing, sale, and transportation of alcohol? It was 1919, but then about 15 years later, in 1934, the 21st Amendment was passed, which made all these things legal once again. Question coming. Okay, what percentage of Americans is considered current drinkers?
75%.
Close. Still close to those numbers. What ages have the highest rates of drinking?
18 through 32.
Close once again. Are college students more or less likely to binge drink?
More likely.
That's right. Okay, why did the percentage of drinkers drop 20% in the age group of 12 through 17 in 1985?
Law restrictions for age of getting alcohol?
That's correct. Okay, some of the answers are, what percentage of Americans are considered current drinkers? It's 2/3 of Americans are considered current drinkers, which is defined as a person who has at least 12 drinks in their lifetime and 1 drink within the past year. But 20% of these people binge drink, which is 5 drinks a night at least once a week. What ages have the highest rates of drinking? It is adults 25 through 44, but ages 18 through 24 have the highest rates of binge drinking, so it's college students. Are college students more or less likely to binge drink? It is yes. College students mostly binge drink as socialization with their peers. No, but these patterns in college don't mean anything after you graduate, so rates will change after you graduate from college. Why did the percentage of drinkers drop 20% in the age group 12 to 17 in 1985? It was because the age to legally drink alcohol was changed from 18 to 21. And while we're on the topic of excessive and binge drinking, I thought I might show you what it's really all about.
Ready to answer some questions?
Yeah.
Alright, what are the 2 enzymes that turn alcohol into vinegar or acetic acid?
Insulin?
No.
That's not right.
What are the 3 health-related outcomes of metabolizing alcohol?
Probably bad things, because alcohol is bad for you. I don't know.
What is the name of alcohol used in drinkable beverages?
Ethanol.
How is tolerance established in alcohol drinkers?
The more you drink, the more tolerant you are, kind of. Sort of.
Close. What is the most common type of withdrawals associated with alcohol?
That is delirium tremens, which is hallucinations and convulsions. Some of the answers to those questions are, what are the 2 enzymes used to turn alcohol into vinegar or acetic acid. The first is alcohol dehydrogenase, which is located in the liver, and its only job is to metabolize alcohol. The second enzyme is called aldehyde dehydrogenase, and it converts aldehyde into acetic acid. What are the three health-related outcomes of metabolizing alcohol? An increase in lactic acid, which causes anxiety attacks, an increase in uric acid, which causes gout, and an increase in fat in the liver and in the blood. What is the name of alcohol that we drink in drinkable beverages? It's ethanol. How is tolerance established in alcohol drinkers? Differentially, so the book says. Heavy use in alcohol for an extended period of time is required for noticeable tolerance. For some people or other people, it only takes like a week to get tolerant to. And what is the most common type of withdrawals associated with alcohol? It's called delirium tremens, which is associated with hallucinations, disorientation, and convulsions. You ready? Round two.
Okay.
Okay. Name a direct hazard of alcohol.
Sclerosis of the liver.
Sclerosis. No.
Sclerosis.
I mean cirrhosis. Yes.
Cirrhosis.
Okay. Does alcohol contribute to the development of cancer?
No.
It's associated with cancer, so kind of. Okay. How does alcohol affect pregnancy?
It causes birth defects.
Sure. Okay. What are some indirect effects of alcohol use?
Addiction?
Sure, it was something a little different. Okay. Are there any benefits to alcohol?
No. None.
Yes, there is. Fail. It's okay. Alright, some of the answers to those questions are, name a direct hazard of alcohol. The liver is the main organ used to detoxify alcohol, and scarring of the liver is called cirrhosis. Does alcohol contribute to the development of cancer? A meta-analysis of 150 studies that show that drinking is associated with cancer of the oral cavity, esophagus, and larynx. Does alcohol affect pregnancy? Yes. Alcohol affects fertility as well as an increase in the development of problems during pregnancy, such as fetal alcohol syndrome, which causes facial abnormalities, growth deficiencies, and mental retardation in the unborn child. What are some indirect effects of alcohol use? Unintentional injuries, such as car accidents, in which 40% of people in car accidents are intoxicated. Also, alcohol is related to aggression, suicide, crime, homicide, mainly because it increases risky behavior, obviously. And are there benefits to alcohol? Yes, there are. Reduced chance of dying from cardiovascular-related illnesses is associated with a light amount of drinking during middle-aged peoples. Are you ready to play?
Yeah.
Alright, good. What are two types of alcoholism associated with the disease model?
Chronic and not chronic?
That's not right. What is alcohol dependency syndrome?
It's where you can't stop drinking alcohol?
Sort of. Yeah. Okay. What are some components of the cognitive theory of why people drink alcohol?
Because they want to feel better and take the pain away?
That is exactly... You got one right! Ding, 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 ding. How does the social learning model provide an explanation for why people drink excessively?
Because people drink with groups and then they get drunk.
It's a good thing I chose a psych major for this section. Good job. Alright, and the answers to this final section are, what are the two types of alcoholism associated with the disease model of alcoholism? The first is gamma alcoholism, which is a loss of control once drinking begins. And the second is delta alcoholism, which is an inability to abstain from alcohol. What is alcohol dependency syndrome? It is when people are alcohol dependent and do not have control over their drinking. There's a really good table of all the elements in this syndrome on page 355 in our book. What are some components of the cognitive theory of why people drink alcohol? Drinking is a way to reduce stress or escape from tension, and people use alcohol to cope with these stressors. How does the social learning model provide an explanation of why people drink excessively? This model shows that social interactions involving alcohol are positively reinforced, and the withdrawals, which is the hangover next day, is negative reinforcement. So people just drink more the next day to get rid of these withdrawal symptoms in the hangover.